All right, I'm going to tell you everything I can think of about labiaplasty surgery. It is going to be my second labiaplasty of the day today. I normally perform it in the office under local anesthesia together with an oral anti-anxiety medication, but today I'm doing it combined with a GYN surgeon. She's doing some internal vaginal tightening and repair of the pelvic floor, and I'm going to make things look pretty on the outside. So a labiaplasty takes about an hour to an hour and a half to perform. It is an elective cosmetic procedure of the labia minora, most commonly, and sometimes the labia majora. The labia minora is the inner lips of the vagina, and the area that we usually want to trim is the area that hangs longer and lower. It is more darkly pigmented, and it has an irregular cobblestone-like texture. The labia majora, the outer lips of the vagina, sometimes we also do a trim in that area. Some women want to actually plump the area up, and we can either add fat graft to the area or filler, but the technique I do most of the time is called the trim procedure, where I always say it's kind of like trimming your bangs, but just down there. And the purpose of a labiaplasty is to help women feel more comfortable, either riding a spinning bike, running, wearing yoga pants or a bikini. And often patients, when they come see me, they say, oh, I'm so embarrassed, I can't believe I'm talking to you about this. I'm like, don't worry, we talk about vagina all day. And it's nothing to be embarrassed about. I meet women who have no issues and they have lots of extra labia minora tissue. And I also meet women where it's a big physical discomfort for them, or they just don't like the way it looks, or they're self-conscious. So plastic surgery is not for everyone, but if there is a part of your body which is bothering you, and if we can tweak it, either subtly or sometimes significantly, if it helps you feel more comfortable in your skin, then it's certainly something to consider. So labiaplasty, as I mentioned, it's performed under local anesthesia. We always inject some numbing, even if you're asleep. The numbing lasts for, on average, 6 or 8 hours, and the numbing has epinephrine in it, adrenaline. So it constricts the blood vessels and it really minimizes bleeding during surgery. We trim the area of excess. We often zap the blood vessels as we come across them, and then we rearrange the tissue and we sew it together in 3 layers of dissolving stitches, so no sutures to be removed. You will have some swelling, you'll have bruising, and the bruising and swelling is often asymmetric. So my best advice for women that are going to have a labiaplasty, don't look. If we do it in the office under local, I will show you with the mirror when we're done. I'll say, okay, now you've seen it, it looks funny. If you peek again, it's going to look really funny. So I see patients in follow-up about a week or 2 after surgery. Quick check, see how they're healing. You can expect some swelling for at least 6 weeks. I recommend that you take at least 3 to 4 weeks off of exercise and sex. For the first menstrual period, you should use pads rather than tampons, and you can go back to tampons for your next menstrual cycle. You can shower the next day. No submerging in water, so no pool, hot tub, bathtub for at least 3 weeks. And you can experience some mild discomfort, but it's not that painful. Often regular Tylenol is enough, although we will give you a little bit of Tylenol with some narcotic to be taken as needed. You want to avoid ibuprofen or any other anti-inflammatory, Advil, Motrin, Aleve, Excedrin, for about 2 weeks before, and don't restart for 2 weeks afterwards, because that can increase bleeding or bruising. We will give you an anti-anxiety medication, not only to take the day of the procedure, it's also helpful the next. We will also give you an anti-anxiety medication to take not only the day of the procedure, but it's helpful the night before the procedure, and then after surgery. If you don't want to take the narcotics, if 2 Tylenol just isn't cutting it, taking an anti-anxiety medication can really take the edge off and help you relax and get to sleep. Your physical restrictions after surgery are no getting your heart rate and blood pressure up, meaning exercise or sex, for about 3 weeks. If you were going into the office, which no one's doing during COVID, except for me, but I would stay out of the office, meaning work from home, for about a week. If you have a very physically active job, you may want to be on modified duties for a couple of weeks. And after surgery, most patients say, especially if they don't look, I actually feel good, I feel comfortable, not that painful, going to the bathroom is no problem, showering is fine, you don't need to do anything special. You may have little spots of bleeding for a couple of days, so you're going to want to change a panty liner in your underwear as needed, and then you'll see me in follow-up at a couple weeks after surgery, at 6 weeks. We usually take some follow-up photos at 3 months, and generally by 3 months, all the surgical swelling is gone. and we like to keep in good touch with our patients and also see you at a year after surgery. And what patients express to me is when they come back for their follow-up photos, they say, oh, Dr. Horton, I've been meaning to look. I wish I could tell you what I think, but honestly, I haven't even thought about it. And that's what it's all about. It's helping your labia area kind of fall off your radar so you don't think about it anymore. You can, throw on that white bikini and sit cross-legged and not have a problem, or, do an extra long spin class and be really comfortable, or, feel comfortable undressing either in the change room or in front of a romantic partner. So labiaplasty surgery is definitely a worthwhile procedure for many women, and I'm happy to share this information with you. If you're interested in seeing some before and after photos, please visit my website. Look at the gallery section. You'll find the labiaplasty section under body. Not safe for work, don't open it on an office computer, but you can look at it at home. And then you'll really have a better idea of why women seek labiaplasty and how we can help them look and feel more comfortable. Thanks.